In your opinion, why was it in the best interest of the University of Kentucky community to return to the reinvented operations this fall?
Well, I mean, I think, well, thanks, Courtney. I think it's incredibly important for the students to have, you know, a residential experience here with all the things that UK offers. I think that, you know, the reinvented part is to do everything possible to make sure that we minimize any risk to the students and the faculty and the staff. And that's why we paid a lot of attention to a strategy that relates to testing and screening and obviously PPE, social distancing. I think everybody can see that's why we're even wearing masks here today as we do this forum as well. We've also paid attention over time with the START team, and Dr. Dutch will talk more about it, to the data and to the emerging evidence that's coming out so that we actually pay attention to things as it goes along through the semester.
All right, thank you, Dean DiPaola.
So, and I'll weigh in now. It's obviously a really difficult decision right now to decide if it's right to come back or not, and universities across the nation have made different decisions. So my research has always been in respiratory viruses and emerging respiratory viruses. So I thought a lot about pandemics and followed things. And around the world, people have dealt with infectious disease since we had people. This is new for many of us, but it's something we all have to figure out, what do we do to approach it? And in the case of reopening, one of the things I think we really wanted to think about is, what are the risks from this virus, and can we mitigate them as much as possible to make it safe? What are the risks if we don't reopen? And that was also a major part of the discussion. Number one, and something that really concerns me, we know that even prior to this pandemic, we have major problems with mental health issues, particularly anxiety and depression for our college-age students. And if you look at information coming out from the CDC, those numbers are skyrocketing through this pandemic. So establishing as much as possible conditions where people can feel back to normal and can start to deal with those and feel better like that is also important for risks. So we were weighing that risk. There's also a major risk in terms of educational equity. Online learning can work well, but not every student has equal access to the tools that you need for online learning, from the internet to a quiet place to study. They don't all have this, and therefore we felt that return is more likely to provide the majority of students the best educational experience.
Thank you both. This question will be for Dean DiPaola. President Capilouto says all the time that we are letting data drive our decisions. Can you elaborate on what this means and how UK has created a modern public health infrastructure to make that possible?
Yeah, absolutely. Very, very important. And I think, you know, and as Dr. Dutch is even pointing out, is we're looking at the campus as a public health community. And the president talks about that as well, where there are opportunities to look at all aspects that would affect student health or staff or faculty. And then to do that, we need to look at the data over time. And that's the data on testing and the results. If there are areas within the campus where we see that there's increased prevalence of COVID-19, it would be an area for increased testing and efforts towards either isolation or quarantine as appropriate to decrease transmission rates. The other thing we're looking at is there are published studies all the time. I think everybody sees regularly on the news more data on whether it's vaccines or whether it's on new therapies or whether it's on, you know, masks or the types of masks that we might use. We're paying attention to that on a regular basis, and we continue to inform the team as a whole and modify as needed along the way. One example that's coming up is even thoughts about and plans towards wastewater testing, which gives us an opportunity to screen residential facilities and to at least have an understanding of whether there are higher risk areas where we would do more testing, again, for the safety of the students and the safety of the staff and the faculty as well.
I think that's great. I have one quick follow-up question. I think one of the other biggest concerns we've seen is the communal living spaces. And so if the START team was to go with the wastewater, could you see that not only being in the residential dorms, but could you see this also going to the communal houses within FSL that we have seen the reason why we had the phase 2 testing?
Yeah, absolutely, and I know Dr. Dutch probably would add to it as well, but you know, we knew even at the beginning of the process in terms of the planning that wastewater might be an option, but we want, as a testing, but we wanted to see the evidence, we wanted to see where we were. Obviously, we've done initial testing, you know, trying to, you know, test all students initially, so we had a baseline, and as we learned from that, and as we learned from the evidence emerging throughout the U.S. of using wastewater as an opportunity, it appears very sensitive to assess any facility. So you could apply it towards a sorority or, you know, or other dorm-like facility. You'd have an understanding what it's picking up. And again, Dr. Dutch will speak to this probably more specifically, but what it's picking up is at least evidence of the virus somewhere in the building. And then we have the opportunity to do additional testing.
Yeah, I know it sounds particularly a little gross maybe to people, but
Yes.
what we're picking up, people when they become infected, they actually shed virus out through their excretions. And so the people who are leading this know carefully which time of the day is the best to pick this up in a system. And you tend to start shedding. So when you get infected, even if you're going to have symptoms, which a good number of people don't, for 2 to 3 days before, you're building up the amount of virus in your system. And then you might start symptoms, but you're infectious before your symptoms come on. The wastewater, or a way of picking up the viral RNA, can start to pick that up even earlier. So you could look, for instance, in fraternities and sororities. I know you mentioned to me your sorority is COVID-free.
Yes, right now.
Which actually,
That's good.
which is amazing for a communal living space, and really speaks to the kinds of things you're doing to be careful. But you might then be able to say, wait a minute, we test this region every day. Yesterday we were here, suddenly we've done this. We've got somebody in that house that has picked this up, we're gonna test immediately. It lets you figure it out very, very quickly. And I know there's been several universities, University of Arizona, for instance, talked about a specific case. I think University of Utah has done the same thing where they could pick things up that way. So it's a way of getting a jump start on figuring out when something started.
That's really awesome. Thank you all for both weighing into that question. I will go back to Dr. Dutch. Why was the phase 1 baseline testing so important to our campus operations this fall? If a test was conducted in early August, why is that relevant now?
So when we looked at what we needed to do to establish as safe a community as we could for our students, one of the things we wanted to do was make sure that we started from the best possible place. So we had a good idea of what we call the community-based level was in Lexington. So people who had been in Lexington all summer, we had a good idea, and I would guess that the number seems to be around 0.3, 0.4%. So there are cases, but it's not that high. But we bring in students from all 50 states. We bring in students internationally, and the baselines in the communities they were coming from could be higher. And in fact, we know some of them were higher. Some of them were coming from places that had much more risk. What we didn't want to do is introduce people who had a much higher chance of bringing the virus with them into a community that had a lower prevalence. So by testing everybody at the beginning, the idea is we can at least start at a very similar level. We can catch most of the cases. Then we know we have this amazing contact tracing system being set up. That then can start tracking any cases that we do see, because new cases will come in from the community. And we can follow it. If we hadn't done that initial testing, we don't actually know how many students arrived with the virus. So I think it's important to point out that initial testing was picking up people who arrived here, bringing it with them, not necessarily, and that for the most part, not necessarily people who caught it here. And so it let us pull them out of the population and protect the rest of the population from them before the semester got going.
Thank you so much. Dean DiPaola, we often hear about new announcements, guidelines, or recommendations from the CDC. Can you explain why some of these recommendations may have changed over time?
Yeah, I think it comes back to, it's a good question. And, you know, it comes back to the question even before relating to paying attention to the emerging evidence. I mean, you know, the number of studies that are coming out related to COVID is just astronomical. I mean, the trajectory of studies we see in, you know, various journals and so forth. Some of them reported very rapidly. You know, sometimes we need to, you know, also see that they're confirmed. But the CDC is paying attention to that. And as they see evidence on whatever type, as I mentioned before, type of mask, whether you use a shield or not, you know, obviously there was initial data on social distancing. And we've become more confident over time that if everybody really works well to have masks on, social distance as best possible. We really reduced the rate down to an incredibly low level. And so I think that's become clear. As a START team and overall, as we meet very regularly, we pay attention to the CDC guidelines, but we don't just stop there. We actually look at the original data, we pay attention to emerging data, and really have an interaction between experts like Dr. Dutch in terms of virology, experts in epidemiology like Dean Arnett, experts that are paying attention to the statistics of things, meaning did something reach a significant difference that we should pay attention to it, and so forth. So we have really a diversity of expertise at the table, paying attention to the CDC recommendations or not. Sometimes the CDC makes recommendations that are applicable to a community and may not be applicable to a campus, and so we try to pay attention to that as well.
Thank you so much. Back to Dr. Dutch. Why is UK only accepting a PCR test?
So there's a variety of tests you can do to pick up this virus. Probably the gold standard is PCR, or polymerase chain reaction, and it can detect very low amounts of virus. It also has a much lower prevalence of false readings. And so if you wanted to get the best possible data on whether someone currently has the virus, the PCR test is going to be the one that gives you the best possible data. It also has a lower percent of false positives, which is very important. Our overall prevalence is relatively low, so you have to think very carefully about that. And I will give huge credit to the members of the START team, in particular Daryl Jennings, who runs our UK Health Core Lab, and who spends hours every day combing and keeping up on the latest testing results. And they can really inform us on exactly how each of these tests will perform and what's best. Now, I think it'll be important to note, over the semester, you're going to hear new things about testing. New testing methods are going to be coming out. And what the START team will be doing is looking at what are those new methods and how could we best use them. Some of them will be great screening methods that we could use. So you'll even see over the semester, I'm guessing we're going to see some changes in the methods we use to test as time progresses. And again, that shows you how fast science is evolving.
And maybe I'll just add to that too as well, for anybody listening, you hear about the sensitivity of a test, as Dr. Dutch pointed out. And we want to do as best possible to assure if somebody came up with a negative that it's a real negative, because you don't want somebody who's infected continuing to transmit. And the sensitivity relates to that most. So when you hear about the sensitivity of a test, very high sensitivity, then it's more likely that you're going to, if you had a negative, it's really a true negative. So trying to reduce the number of false negatives. So we pay attention to that, but as Dr. Dutch said, it's going to evolve over time. We may have more opportunities. They did an amazing job in being able to test so many students in a short period of time, and continue to test, as phase 2, continues to roll out.
No, for sure. I was definitely impressed to see that we were able to test 30,000 students within a short amount of time. Dr. Dutch and I were joking afterwards. I said that's almost the size of my hometown, and so of course, it's almost like adding a hometown to for people that are from Kentucky onto the city of Lexington when the UK campus came back. So, Dean DiPaola, I'll go back to you. What are UK's next steps with regarding to retesting and other measures to enhance safety or inform interventions?
Well, I think it's going to be important to continue the things that we know works. So I think continuing to educate about that is going to be critically important, like masks, social distancing. And, I know we've said it a couple of times, and I think it's really important to emphasize to all of us, not just the students, the staff, the faculty. The other thing are new things like we've started, and I mentioned it a bit earlier. Probably the newest in this phase would be looking at wastewater testing. Then we've got to look at those results and make some decisions on where do you do additional testing. So we're at a point where we are retesting, but we're doing it in a careful way where we pay attention to areas that are either at higher risk or that the wastewater testing will lead us to to test. And so it'll be some of those things that are going on kind of in the next phase. I think that it'll be important to continue to monitor the results of studies that look at things like the type of mask or whether shields and things like that. And those are adjustments that we can make along the way. But I think that what's going to be critically important is that we continue to test. And a topic that you may get to as well is contact tracing. Effectively not only identify those that are positive, but the contacts they may have come in contact with. Some of the emerging data, and even changed in the CDC, was how long you need to isolate somebody who has had COVID, because they might shed virus even longer than they are infective. So some of those things might also modify over time.
And I know you mentioned a couple of times throughout this event today about wastewater testing. Do you think that will be in phase 3 rollout for the university, or is that already begun testing?
So it's actually started this week.
Oh.
The first detectors are being set up. They're using Ingalls Hall to set the positive rate, because we know that that's where they're isolating students who were infected. And then getting they've got some already set up, others on order, other sites are getting set up, and they've been looking. Sounds like a strange thing to talk about at 7 o'clock in the morning, but we did that this week. Talked about where's the best waste, where do we want to open the sewage systems up and check how many different people would we catch in these places. Yeah. So it's already going on.
That's awesome and great to hear from, especially from a student perspective, where I know a lot of students are wondering how often to get tested and what is the university continuing to doing around testing. And I think it's not just students. I think community members, parents are also curious. So great to hear that that is continuing and also beginning this week. So Dr. Dutch, I'm going to go back to you. What do you believe will be the long-term effects of this virus on UK?
That's a great question. And a difficult question to ask. Obviously, in the short term, and may phase out to the long term, we're going to have a lot of people who have had to struggle. I've been impressed with the university's commitment to putting in additional counseling services. I know when we started to talk about isolation, one of the first things that came up at START, and I can't remember who brought it up, but one of the START members immediately said, we have to have mental health services involved. You're taking students and isolating them. So I think that's ramped up. I'm hoping that ramp up then continues on, and that focus on having even more ways to make sure we help people continues. I think you're going to find, for a positive, that we're all a little more adept at doing learning in different ways. So I love teaching in person. So I teach Monday, Wednesday, Friday in person right now. I like teaching in person, but I'm now much more comfortable teaching with Zoom. I teach with Zoom at the same time I teach in person. And that will allow us to better meet the needs of some students. I think it's important to note that the university is extremely accommodating this semester. If a student has a valid reason that they don't want to be physically in a classroom, the university works with you on that. And I think that will continue, and we may find new ways to educate, and those will be, I think, potentially really positive. I do think we're going to have a year that we all have to keep adjusting to what's hit. And it will take time. I have a lot of people ask, is this ever going to go away? It is. We've dealt with pandemics, as I said, for the history of mankind. The last time we had one quite this bad would have been 1918. But a year after it, people's lives were going back to, it was a new normal because some things had changed. But it was still going back to a life that didn't focus on the virus, and we will get there. I also think we'll probably have more people work from home a little bit more. Again, people have gotten much better at that than they used to, and we hopefully can help train our students in how to work in all those different ways, because I think that'll make them even better qualified for all the positions they're going for.
I was going to, even one on the health end, because we also work with on the UK healthcare end as well. It's introduced telemedicine in a way we've never had before, and I think that'll remain as an opportunity. Additionally, as an additional opportunity in terms of care, for patients at a distance to get care. So I think that's enhanced a number of different things, and I would agree with Dr. Dutch. I think the university here, offers so many services, and the mental health services and opportunities there are going to be very, very important going forward. And I think, I don't know if I mean, the links are on the website and so forth, but I think it's important for all students to know that those are available for them. And I think it'll be important, now and even in the future as well.
I think so too. And one of the things I was telling my family members when we were going home, and I was like, I'm a business major, and so something that I've seen is I don't think that a lot of the companies that I apply for moving forward will have all of their employees in those cubicles, as we've seen kind of the trend being. I actually was in one of my first classes, and one of my professors said, I think or the home trend on the real estate market was a very open floor plan, and now we're seeing some trends of a more choppy plan again, because and a more closed off plan, because they need an office space. So we have just a little bit more time, and one of the big questions or myths that is I was speaking with Dr. Dutch about before you got here, Dean DiPaola, around, are we going to go home before 11/24? And I think one of the things I remind students is we will hurt the city of Lexington if we go home, because then we don't have the structure of coming to the classroom, when we don't have the structure of being on campus with all of the resources like mental health, like the UHS, like the huge enterprise we have of UK Healthcare. So I guess my question to both of you is, if you could give what is your thought process on how long we will be here? Because my goal is 11/24, and I know the president continuously says 11/24, but I think hearing your perspective for the community or for students would be really, really helpful and assuring.
So
Okay, why don't you start?
I think we can make 11/24. That is my goal. I don't think that any of the people weighing in on this in the beginning would have reopened if we thought there wasn't a good chance that we could. Is it possible that we'll have to make some changes? Absolutely. And I know that people get tired of hearing me complain or tell them what to do. I tell my class every morning, and I would joke that my 82-year-old mother says I'm the COVID dictator, all the things she's not allowed to do. This is not the time to ignore the rules we're giving. I think it's important for all of us to remember there's reasons for those rules. If you sit down at the end of the day and you can think of more than just your immediate cohort, which would be like your family if you live at home, or you and your roommate, if you're that number, if there's more people than that you were within 6 feet without a mask on for 15 minutes or more, you need to rethink what you're doing, because that means you're risking the spread. So we need to take it seriously. We also need to think carefully about some of our behaviors. One of the things that I'm concerned about, we're coming up on Labor Day weekend, even though Labor Day is actually not a holiday. I'm teaching on Monday. This is not the time to go home. That's a horrible message to tell people, but going back and forth and traveling just increases the risk you'll spread it. If you have it, it increases the risk you'll take it home to your home community, and in many cases, many of us have higher risk people at home. On the other hand, you could go home to that home community, pick it up, and bring it back. So the best thing we can do is to limit the amount of interactions we have that might increase the risk. And then I think we can make it. We might have to slow some stuff down. There might be some situations when people go online for a little bit, but we have amazing resources here for helping people if they were to catch it. We have a world-class health system. So I think that we can do it. We just all have to make sure we do the very best job we can to limit spread.
Yeah, and I would also agree. I mean, I think we're right on track to be able to make it through. I mean, we have to be careful, and I think that it is very important what Dr. Dutch said, you know, especially, you know, going, you know, out on the weekend in terms of large gatherings and so forth. I mean, we just need to all be really, really cautious right now and really careful. And, you know, if we are, you know, we'll get through. I think that, you know, the other point Dr. Dutch made, you know, is that, you know, you can't over talk about this and educate, you know, in terms of masking, in terms of gathering, you know, the more numbers that get together in a, you know, in a kind of a closed-in space, you know, the more concerning it is, and especially if they go off campus and then come back to campus. But in terms of capacity, right now we have capacity to isolate as we need to reduce transmission. We have capacity in the health system as well to take care of the patients we need. And we have capacity to test and increase testing as needed in terms of retesting. So all those measures have been put in place, very carefully thought out, very strategic. And right now we're on track. But everybody out there who's listening, please remind everyone, doing, you know, getting together in a gathering or something like that might put it at risk for, you know, for going a different, you know, a different direction. So we all need to just do our part, just like we are here with the masks,
Yeah.
you know.
Yeah,
And
so
hopefully everybody can hear us as well.
And I think on an interesting note about this, it was just this morning, I think, in a New York Times article that Tony Fauci came out and said the last thing he would want universities to do is shut and send everybody home.
Right.
We here have all sorts of tools to deal with this virus if someone gets it. Everything from the isolations to the contact tracing to the medical teams to the counseling services. And I'm very concerned about sending people home into homes that have vulnerable populations. We all need to remember that someone the age of most of our students is likely to come through this okay. Now, there can be some younger people who have longer term effects, and is a reason to take this virus seriously. But if you go home to people who are much more high risk, the chances that you'll spread it to someone who will not be okay are good. You can spread it easily, and then it's a real problem. So that's one more reason to think really carefully about what you do, including thinking carefully through the interactions you have with people who aren't in your small living environment. And I also think it's a good learning environment for all of us to figure out what to do. I thought it was wonderful that the university jumped on retesting fraternity sororities because they said, oh, this one group is higher. But as your story shows, there are ways to live in that communal housing safely. The university's got tools, and I'm sure would love ideas, anything they can to make sure those situations stay as safe as possible. Now we just want to make sure that we do everything we can as a group, as students, staff, and faculty to keep everyone safe.
For sure. I think I really appreciate you guys both answering that question. And one of the things I keep reminding myself every day is just take the 10 extra seconds to wipe down my surface that I've used in my communal space. So we have disinfectant everywhere. Take the 10 extra seconds to put your hand under the hand sanitizer. Take the 10 extra seconds to use hand sanitizer or wash my hands for 20 seconds. Take the 20 or 30 seconds in the bathroom extra than you have before, because that's the way we're gonna get through this, is wearing a mask when it's not your roommate for our students, and making sure that we're staying physically distant, because it's really hard. It's not our social norm to be 6 feet apart and to not shake hands and to not give people hugs, but that's what we have to do. And so I really appreciate both of you taking your time today to speak with me and also have this conversation. I know it was helpful for not only me, but I'm sure people watching on Facebook. So unless you have anything additional to add, I really appreciate it, and thank you guys so much for coming.
Yeah, thank you all.
Thank you.
We appreciate it. Thank you.